Raphael, nothing to worry about. Maybe some rain on Sunday and maybe some cold weather. Well, cooler weather by next Friday, hopefully. Medicare open enrollment is underway. Whether you're newly eligible for Medicare or if you've had it for years, there's a whole lot to learn about the program. Dr. Brent Wallis, our good friend, Dr. B, Chief Medical Officer of People's Health, joins us. Talk about some common Medicare myths. How are you, Dr. B?
Hey, Tommy, I'm doing good. Can you believe this second summer we're having?
Man, it's ridiculous is what it is. Not to mention second hurricane season, it seems like. Although technically it never went away. But let's talk about these Medicare myths. What is myth number one, Doc?
Yeah, so a lot of people think that original Medicare covers everything, and it does cover most of your medically necessary services. So that's things you may get in a hospital or a doctor's office or maybe a skilled nursing facility. But what it doesn't cover is additional services, things like routine dental or vision care. And keep in mind that it does not include Part D drug coverage either. So for your drugs, you're going to have to get a separate plan. And that's why a lot of people choose to enroll in a Medicare Advantage plan.
Tell us about those Medicare Advantage plans, please.
Yeah, so, original Medicare is administered directly by the federal government, and the Medicare Advantage plans are offered by private insurance companies that actually have a contract with Medicare. And so those Medicare Advantage plans still have to follow all the same rules as Medicare, and they cover all the same services that original Medicare covers. But they offer a lot of extra benefits, too. And that may be things like a fitness center membership. Like I mentioned, it could cover routine services like dental, vision, or hearing exams. And you may even get a credit for over-the-counter health and wellness items. And then, like I mentioned, many Medicare Advantage plans also cover Part D prescription drugs, whereas Medicare does not. So you don't have to get a standalone drug plan for all of your medications.
All right, so that's myth number one. Original Medicare covers everything. It does not, right?
It does not.
It does not, definitely. That's right. Okay,
that is true.
Doc, when we talk about this, it can be eye-glazing. Let's talk about myth number two about if you join a Medicare Advantage plan, you don't have Medicare anymore.
Yeah, some people think that you're actually giving up your Medicare when you join a Medicare Advantage plan, but you still have your Medicare, and you have all the same rights and protections that come along with Medicare. But your Medicare Advantage plan is going to be the one that administers those benefits for you. And so the biggest difference is when you go to the doctor, you're going to have to show your health plan ID card, like your People's Health ID card, at the doctor or pharmacy or anywhere you may go, instead of your red, white, and blue card. A lot of people know the red, white, and blue card is the Medicare card. You want to keep that one in your wallet if you have Medicare Advantage.
I feel like we should be blowing something up because we're busting myths here. Myth number one, original Medicare covers everything. Busted. Myth number two, if you join a Medicare Advantage plan, you don't have Medicare anymore. Busted. Let's talk about myth number three. Medicare Advantage plans are more expensive than original Medicare.
So this one's not a total bust, but not necessarily. Every plan is going to have different costs and different benefits. But in general, your overall cost with a Medicare Advantage plan is usually lower than your cost under original Medicare. And the main reason for that is because Medicare Advantage plans are required to limit your yearly out-of-pocket costs, so the amount that you have to pay to see the doctor or get a prescription filled, whereas original Medicare does not have any ceiling on those yearly expenses. So if you get a really expensive service, you may have to pay a lot more than you would under a Medicare Advantage plan.
So the extra benefits do not make Medicare Advantage more expensive?
No, they really don't, and a lot of these extra benefits provide a lot of extra value to people. And so a good example I use is if you think about dental cleaning. Without any insurance, it's going to cost you about $100 for a routine cleaning. And if you have original Medicare, keep in mind that it doesn't cover any dental services, and so you would likely have to pay the entire $100 out of pocket. But if you're in a Medicare Advantage plan that does have dental coverage, you won't have to pay the full amount. And you may not even have to pay anything if it's included with a $0 copay. And those savings can really add up when you think about things like vision care, hearing care, and dental care, because all of those are not covered by original Medicare.
All right, let's talk about another myth that all Medicare Advantage plans have the same cost.
Yeah, that is not true. So some Medicare Advantage busted, yes. Some Medicare Advantage plans have a monthly plan premium that you may have to pay in addition to your Part B premium. Some of them may have an annual deductible for your medical services or your drugs, and really all that means is that you have to pay a certain amount out of pocket before the plan kicks in and starts paying towards those costs. But not all Medicare Advantage plans have those premiums or deductibles, and that's why it's so important to make sure you look at what is covered, what's not covered, and do you have any extra cost when you're choosing what your coverage is going to be for next year.
What are some of the other costs with a Medicare Advantage plan?
Yeah, so like I just mentioned, you generally have to pay a copay or a coinsurance for any medical service or drug that you're getting, and that means you'll have to pay a small amount of money or maybe a percentage of what the total cost is. But keep in mind that there are a lot of services, things like primary care visits and preventative services and even screenings that may be covered at absolutely no cost to you.
All right, so we've been through 4 Medicare myths, busted 3.5 of them, accurate?
3.5, yeah.
3.5. All right, we'll pick it up with number 5 when we come back about changing your Medicare coverage whenever you want. It is Medicare open enrollment right now. Dr. Brent Wallis, Chief Medical Officer of People's Health, our good friend, is here to try to walk us through it. It can get complicated. 8:20 traffic now, WWL. All right, 8:25 and a half, Tommy Tucker, WWL, talking to our good friend, Dr. Brent Wallis, Dr. B, Chief Medical Officer of People's Health, about Medicare myths. Myth number 1, original Medicare covers everything, busted. Myth number 2, if you join a Medicare Advantage plan, you don't have Medicare anymore. Busted. Myth number 3, Medicare Advantage plans are more expensive than original Medicare. That was nuanced. Accurate?
That is correct.
Nuanced. Myth number 4, all Medicare Advantage plans have the same cost. That's busted. Let's talk about myth number 5, Doc, which is you can change your Medicare coverage whenever you want.
Yeah, so this one's busted, and it's very important. This one's very important. You can only change your Medicare coverage during what is called an enrollment period. And for most people, the best opportunity is really right now. This is the Medicare annual enrollment period, or what we call AEP. And it runs every year from October 15th through December 7th. And this is really the time where any coverage changes you want to make that are going to become effective on January 1st, this is the time to do it.
Generally speaking, if you have Medicare, is this the only time of the year you can make changes?
In general, yes. You know, AEP is your chance to make all of those coverage changes, but there are some exceptions to the rule, as there always are. You know, if you meet certain criteria, you may qualify for what's called a special enrollment period, and that's going to let you make changes at other times during the year. And really, the biggest time you qualify for those is when you've had a change in your Medicaid coverage, or if you lose coverage through your employer, or if you have certain types of chronic health conditions, so things like diabetes or heart failure or cardiovascular disorders. But don't rely on those special enrollment periods. You want to review everything this year. A lot of people don't qualify for those special enrollments. So you want to review all that coverage before the December 7th deadline. And even if you're happy with your current plan, you really want to know what's changing for the next year and think about whether or not that's going to impact you. You don't want to be surprised by cost increases, you know, for your doctor's visits or your drugs when you get into the new year.
Do you have to change your Medicare coverage every year?
You don't have to. So if you're satisfied with your current health plan, you don't have to make any changes at all during AEP. You'll automatically be rolled over in your current plan unless you choose to enroll in a different one.
So if you want to change your coverage, if you do decide to do that, what options do you have?
Yeah, there's a few options depending on what you have right now. So if right now in 2024 you've got original Medicare, you can choose to enroll in a Medicare Advantage plan, or you can choose to switch your Part D drug plan. And if right now you are enrolled in a Medicare Advantage plan, you can actually switch to a different Medicare Advantage plan that better meets your needs, or you can actually choose Part D coverage and switch back to original Medicare. So it gets a little confusing. That's why you want to talk to somebody about all this stuff.
Yeah, and that brings us to the People's Health Center, which we were at on October. What was the first day of open enrollment?
I think October 15th.
15th, yeah. Tell us about that center, Doc, because it's a beautiful facility, and I know appointments are recommended, but you do take care of walk-ins, and people tend to put stuff off. Maybe with the election, they put it off. Tell me about the center and what's waiting for them there, if you would.
Yeah, it's a great place to kind of stop in. You've got a month left of annual enrollment right now. You know, we're located right next to Party City on Veterans. You can come in. It's very no pressure. They can talk to you about Medicare. They can talk to you about Medicare Advantage plans. There's really no hard sell, and there's no obligation to actually join People's Health. It's really just to get an idea about what all these rules are, what coverage you have, and what really makes sense for you to have next year. So I encourage people to come in. If you've got older parents that are on Medicare, you may want to come in with them as well and ask any questions you have.
And I think it's important. I always say this, but that you know, nobody's trying to sell you a car. They're not going to say, "Let me go talk to my manager. What's it going to take for me to put you in this plan?" All they're doing is there to answer questions. That's all it is. There's no obligation, no cost, no high sale, no nothing.
Yeah, absolutely. Have a cup of coffee and just learn a little bit about this very, very complex topic.
And they're very patient. They're very knowledgeable. They'll take as much time as you need. Thank you, Dr. B. Have a good weekend. Pet the puppies for me.
Absolutely. Thanks, Tommy. You too.
Bet. If you'd like to meet a representative in person, again, you can visit that People's Health Medicare Center in Metairie, 3017 Vets, right next to Party City. As we say, appointments are recommended, but they'll be glad to help you if you walk in. They'll take you, sit you in a little room, show you a presentation and about Medicare in general and answer any questions patiently that you may have. You can always go to peopleshealth.com, or you can just call 1-800-978-9765 or go to peopleshealth.com.